Our group's topic is Lyme disease. I will now explain the etiology of it. The bacteria that causes Lyme disease is called Borrelia burgdorferi. It is an obligate pathogen. This means that it is a bacteria that must cause disease in order to be transmitted from one host to another, and infect a host in order to survive. Borrelia burgdorferi has a gram-negative stain. Therefore, this bacteria has 3 layers. Going from the outside to the inside, as you can see in the picture, it first has an outer membrane, a cell wall, and a cell membrane. The cell membrane within Borrelia burgdorferi contains a long and cylindrical protoplasm that is made of many plasmids. This bacteria is a spirochete. This means that it has a helical shape. As you can see in the picture, it goes in helical shapes. Borrelia burgdorferi has a flagella which enables it to move. The bacteria's flagella is located in the periplasm between the outer and inner membrane. You can see this in the picture as well. This bacteria moves by twisting and spinning using its endoflagella, also known as an axial filament. The movement of the flagella also causes inflammation to the tissues as it enters the body. In this first picture, you can see that the skin is inflamed. In the second one, you can see the Borrelia burgdorferi entering into the skin. Borrelia burgdorferi is different from other kinds of organisms because it is the only organism to use manganese instead of iron to make enzymes. Borrelia burgdorferi also does not have endospores.
Okay, so I was given reservoir and the signs and symptoms of Lyme disease. So we're just going to get into it and start by asking a basic question, which is, what is Lyme disease? Well, it's a tick-borne illness caused by the bacterium Borrelia burgdorferi, and it's kind of a tongue twister. But Lyme disease is spread through the bite and attachment of infected ticks. The most known tick to carry Lyme disease is called the deer tick. What happens is when a tick that carries Lyme disease bites their host, the tick then passes the Borrelia burgdorferi bacterium through the skin, which then enters the bloodstream of the host, therefore infecting the host. There has been no evidence that Lyme disease can be spread from person to person. This means kissing, touching, sexual interactions, etc. However, Lyme disease bacteria can live in blood that is stored, such as blood donations, but once the infection is treated, it will no longer be in your bloodstream. So Lyme disease commonly infects children from the ages of 9 to 14, and then adults from the ages of 14 or 44 to 50 years old. To contact Lyme disease, the tick must be attached to you for at least 36 to 48 hours before the Lyme disease bacteria can be transferred. As a result, you can be bit by a tick and not contract Lyme disease by finding the attached tick before 48 hours. Removing the tick's body and its attached location also helps with Lyme disease, so you don't get it, and then contacting a doctor right away. The process by which ticks become attached to you is a tick will jump or fall onto the host. Once on, the tick will then grasp the skin and cut the surface. The tick will then burrow its head into the cut and insert its feeding tube. The tick will then release a cement-like substance that will help it become firmly attached to the host. Unlike other insects, a tick's bite is painless and you can't feel it. This is why ticks and Lyme disease are very hard to detect with most patients. You should always check for ticks after hikes or any outdoor activity that are surrounded by trees and bushes, basically. When you are looking for ticks on your body, ticks like warm, moist areas and can be located in or around the armpits, groin, scalp, or any other body crevices. So those are what you should be looking for and how ticks basically attach to you. Some of the symptoms you should be aware of is that There are rashes that will often appear in a bullseye pattern on your skin all over. Flu-like symptoms such as fever, fatigue, nausea, and a constant feeling of overall sickness and discomfort. More signs and symptoms that are focused on your body are that your joints and muscles will begin to feel stiff, and swelling will begin to occur in your basically joints and muscles as well, and it will become intense. You can also experience weakness in your arms and legs, which includes shakiness while standing or sitting. You can also begin to feel numbness or tingling sensation in your hands and feet. These symptoms do not all come at once, but they do come one or two times within the next 2 weeks or so on. This is why so many people don't go to the doctor right away, and because they don't have the symptoms right away, and then that's when the case worsens. Some of the more long-term effects are facial palsy, memory impairment, heart rhythm irregularities, inflammation in joints and knees, neuropathy. In some cases, patients have been known to be irritable to sunlight. The good thing is that with early prognosis, most of these symptoms, if not all, can be treated and you can be cured of everything.
Hello, I am Linda Groneman, and my group is presenting on Lyme disease. My segment is on transmission. Lyme disease is transmitted by the bite of an infected tick on the Pacific coast. It is transmitted by the western black-legged tick, and it is transferred by black-legged tick on the north-central U.S., the northeastern United States, and the mid-Atlantic areas of the U.S. When a tick chooses and attaches to a host, it will stand on the edge of a blade of grass or a leaf and hold up his front legs, kind of like he wants a hug. And when a host walks by, he will climb aboard, and when he finds a good place to bite the host, he will then secrete a saliva that has a numbing agent in it, and then also has a substance like concrete that'll help hold him in place. The tick will feed for days, and then if the host has the Lyme disease bacteria, the tick will acquire it and then pass it on to the next host. The time to transmit is about 36 to 48 hours in most cases, so it's best if you can remove the tick before that time, and that really reduces the chance of getting the disease. And then also, the most likely season to become infected is the late spring or the early summer. Lyme disease is transmitted by the tick feeding on an infected animal or host. If it does and later feeds on a human, the human can become infected. You can get it possibly from a blood transfusion, since the bacteria can live in the stored blood. And if you are pregnant, it can be transmitted in the get a placental infection and a stillbirth if it is not treated. And the ways that Lyme disease is not transmitted is touching, kissing, sex, breast milk directly from the animal, in the air, the water, or other insect bites.
I'm Suzanne Strong, and I'm going to talk on the treatment and prevention of Lyme disease. The treatment of Lyme disease is primarily with the use of antibiotics. In the majority of individuals, antibiotics are an effective way of eliminating the symptoms and curing the infection. Oral antibiotics would be the first treatment in treating a patient with an early stage of Lyme disease. Doxycycline, cefuroxime, and amoxicillin are commonly used to treat this stage. In general, these antibiotics are given daily for 14 to 21 days. Intravenous antibiotics are used in treating late Lyme disease. This is usually when the disease involves arthritis or neurologic conditions. Ceftriaxone and penicillin are the commonly used intravenous antibiotics. These antibiotics would generally be administered for 14 to 28 days. Most symptoms of Lyme disease can improve quickly, but some symptoms can take weeks or months to improve. These symptoms may include fatigue, headache, or joint pain. Post-treatment Lyme disease syndrome, commonly called chronic Lyme disease, is when these symptoms last for more than 6 months after a patient has been given antibiotics. Giving the patient more antibiotics will not decrease the symptoms. Doctors at this point will focus more on treating the symptoms. Prevention. There is no evidence that Lyme disease is transmitted from person to person. Since Lyme disease is primarily transmitted by ticks, the best prevention of this disease is to protect yourself against tick bites. There are a number of ways you can do this. When you are enjoying the outdoors, walk in the center of trails to avoid grassy, brushy, and wooded areas. It is important to use a repellent that contains at least 20% DEET on exposed skin and to use permethrin to treat clothing, such as shoes, pants, and socks before going in areas where you may be exposed to ticks. Shower soon after being outdoors. It is recommended that you do this within 2 hours. Be sure to do a full body check using a full-length or handheld mirror. There are several areas you need to check. Some of these areas include hair in and behind the ears, under the arms, the back of your knees, waist, belly button, and between the legs. Ticks can be carried home on pets, clothing, and other items. Carefully check your pets and other items to prevent ticks from later attaching to you. One way to kill ticks on clothing is to put your clothes in the dryer and dry them on high heat for 10 minutes. If your clothes need washing, it is recommended that you wash your clothes on hot water. Hot water will be more effective in killing ticks. If your clothing cannot tolerate being washed in hot water, it is recommended that you dry your clothes on high heat for 60 minutes or dry your clothes on low heat for 90 minutes. By using these precautions, you can significantly decrease your risk of getting Lyme disease.